Dear students, welcome back. In the previous session, we have finished the coccyx as well as the sacrum in the previous session. Now, today we are going to deal with the bony pelvis. Here, the bony pelvis, which is the skeleton of the lower abdomen. Here we are going to see what are the bones which forms such a kind of skeleton in the lower abdomen, and what are the divisions of the pelvis, and also some of the osteometry of the bony pelvis, that is the diameters of inlet and outlet of this bony pelvis. In the next one we are going to see in this session are some of the obstetric measurements which helps the obstetrician in the case of pelvic assessment during antenatal as well as during pregnancy and also postnatal conditions, and also the types of female pelvis, and also finally we are going to discuss about the differences between the male and female pelvis in this session. Now we are going to see how this bony pelvis is formed. Okay, so the bony pelvis, which is the skeleton of the lower abdomen, is formed by the hip bones and the sacrum. So these are the hip bones and another one is the sacrum. So by the union of this hip bones and the sacrum, here you can see the articular surface which is present on the hip bone for the articulation with the sacrum, forming sacroiliac joint. And this hip bones is also made up of with three bones. So this expanded part of the hip bone is called as ilium, and this lower part is called as ischium, and the upper part is called as pubis. So all these three bones unite to form as hip bone. This is also called as innominate bone. So on the lateral surface of this hip bone is having a cavity called as acetabulum, which articulates with the head of the femur to form hip joint. So this will comes under lower limb. We are going to discuss in detail about this bony parts of the hip as well as the femur and the joint in detail in the lower limb. So in this session you have to understand what are the main parts of this hip bone. Okay, we will see first the parts of all this pelvis. So mainly it is formed by the fusion of two hip bones, that is 1 and 2 hip bones and the sacrum. Okay, so now on the sacrum, you know that it is having a base. Over this you'll have the body and the ala and the sacral promontory on the anterior aspect, and also that forms the base, and it is also having an apex. So this apex articulates with the base of the coccyx, forming sacrococcygeal joint there. Okay, so these are the things present in this sacrum, which is related to the pelvis. And coming to this hip bone, so this hip bone is having an expanded part. This is called as ilia, and it is having some depression on the medial surface, so that is called fossa, that is called iliac fossa. And over this ilium a crest like structure is present called as iliac crest, And to this iliac crest, it is having a spine-like structure anteriorly as well as posteriorly. We are mainly concentrating here is with the anterior iliac spine. It is also having two spines anteriorly, but one is anterior superior iliac spine and anterior inferior iliac spine. So here you can see the inferior, and we are mainly concentrating about anterior superior iliac spine. Okay, so anterior iliac spine, iliac crest and iliac fossa. Okay, these are the structures, and this bone is also obliquely placed. If you can see here, the pelvis is also placed obliquely. It is not present purely in sagittal plane or in coronal plane. It is placed in oblique plane. Okay, it is making some angle with sagittal plane, or it is making some angle with coronal plane here. Okay, and here inside you can see, so this part is called as ischial spine. So that is the spine which is related to the ischium bone on the medial side. This is called ischial spine. With the presence of ischial spine, it is having two notches. One is the greater sciatic notch, that means above this ischial spine, it forming a notch here. You can clearly see here this one is the greater sciatic notch. Below this spine you'll have a lesser sciatic notch. Okay, so this is called as ischial spine. Okay, now some of the foramen which is present by the fusion of this pubis and the ischium, that is called as obturator foramen. Okay, this is the pubic bone and this is the pubic crest you'll having, and also the superior border or superior surface of this pubis is called as pecten pubis, which is also present here. These are the two parts, pubic crest and the pecten pubis, which helps in the formation of some line called as arcuate line, that we will discuss later. So you have to understand the parts here. And also because of this two pubis are united here, that is called as pubic symphysis, it is making an angle here that is called as subpubic angle. So these are all the parts you should keep in mind to understand the structure of this pelvis and also division of this pelvis. So these are all the parts, bony parts of the pelvis. Okay, now we'll see. So this pelvis is divided into two divisions. One is called as greater pelvis and lesser pelvis. The greater pelvis is called as false pelvis and lesser pelvis is called as true pelvis. That true pelvis is called as bony pelvis. Okay, so which forms the false pelvis or the greater pelvis? What are its boundaries? And which forms the lesser pelvis and what are its boundaries? Now we are going to see. Okay, now the first one is the greater pelvis. So the greater pelvis is the expanded part of the ilia and its cavity is a part of the abdomen, and this greater pelvis forms the part of the abdomen. Okay, so this is the expanded part. So this is the expanded part. So already this bone, this hip bones are placed obliquely. So on the anterior surface of this pelvis, greater pelvis does not have any bony component. Okay, only on the sides and posterior only it is having a bony parts. Okay, so this forms the greater pelvis or false pelvis, and this area is included under the abdomen. Okay, now we will see what are the walls of the greater pelvis. The walls of the greater pelvis are formed by the broad upper parts of the two iliac bones. So this is the broad upper parts of the two iliac bones, mainly by the iliac fossae. So on the two hip bones, you'll have this iliac fossa here. So this forms the greater part. Okay, and posteriorly by the base of the sacrum. Okay, so it is formed by the walls of the greater pelvis are formed by the broad upper parts of the two iliac bones, that is iliac fossa, and posteriorly by the base of the sacrum. The greater pelvis have no anterior bony wall. So on the anterior aspect, so here you can see the anterior aspect, there is no bony aspect, and here normally that part is covered by the muscles. The anterior part is covered by the abdominal muscles. Okay, so there is no anterior bony wall. So in the lower part of the abdomen. Okay, and it is merely present at the lower part of the abdomen. Which one? The greater pelvis or false pelvis. So this is called as false pelvis. So it doesn't have any anterior bony structure. So it forms the false pelvis. Okay, now there is a communication between false pelvis and this greater pelvis, that is called as superior pelvic aperture or pelvic inlet. So these are all the things which forms the superior pelvic aperture. So this one separates the greater pelvis and the lesser pelvis. Below this inlet, you'll have the lesser pelvis. Okay. So now if you can see the margins of this aperture, only the margins of this inlet, we can see how this inlet is formed. The margins of aperture constitute the pelvic brim. So how this pelvic brim is formed here? So behind, it is formed by the sacral promontory and the ridge separating the superior and anterior surfaces of the sacrum. So these are the lines you can see here, that is A, B, C, D and E. These are the parts which forms the pelvic brim. So what are the structures? One is the sacral promontory. Behind the sacral promontory, behind by the sacral promontory, and the ridge which separating the superior and anterior surface of the sacrum. The ridge which separating superior and the anterior surface of the sacrum, that is B part. Okay, one is the sacral promontory. So behind the brim, which is having the structures on behind the brim, is one is the sacral promontory, and the next one is the ridge which is separating the superior and anterior surface of the sacrum, and next one is the third one on either side by the arcuate line of the ilium. Arcuate means arch-like line. So this is the arcuate line of the ilium. So on both the side it is having an arcuate line of the ilium, and anteriorly by the pecten pubis. So I have already mentioned the pecten pubis and also the pubic crest. So pecten pubis and the pubic crest. Okay, so the structures which forming this pelvic brim. What are the structures? One is the arcuate line, except this sacral promontory. So the arcuate line, the pecten pubis and pubic crest are collectively referred as linea terminalis. So simply we can call it as sacral promontory, one structure, and the linea terminalis on both the sides forms the pelvic brim. We can call it as pelvic brim. Okay. Now, so this is the borders of the pelvic brim, that is the borders of the superior aperture of the pelvis, true pelvis. Okay, and this thing is separating the greater pelvis from the lesser pelvis. Now coming to the cavity of the lesser pelvis, and this lesser pelvis is bounded. So this lesser pelvis is bounded anteriorly by the that means in front of the body, in front by the body and the rami of the pubis. So simply we can call it as rami and the body of the pubis. On either side by the pelvic surfaces of the ilium and ischium below the arcuate line. So this is the arcuate line. Below the arcuate line, you'll have some surfaces, that is the pelvic surfaces of ilium and the ischium below this arcuate line, and behind the anterior surfaces of the sacrum and coccyx. So the cavity of the lesser pelvis is bounded in front by the body and rami of the pubis, on either side by the pelvic surfaces of the ilium and ischium below the arcuate line, and behind the anterior surfaces of the sacrum and the coccyx. Okay, so this is the boundaries of the lesser pelvis. And so we have seen the superior pelvic aperture, isn't it? Now we are going to see the inferior pelvic aperture or pelvic outlet. So this pelvic outlet is highly irregular, and it is bounded anteriorly by the pubic arch. So anteriorly by the pubic arch, and laterally by the ischial tuberosities. Laterally by this ischial tuberosities. Here you can find this ischial tuberosities. And also the lesser sciatic notch. So lesser sciatic notch is present below the ischial spine, and also the greater sciatic notch, and posteriorly by the lateral margin of the sacrum and lateral margin of the sacrum and the coccyx. So these are the structures which forms the outlet of the pelvis, and it is also intact with some of the ligaments, that is the lateral margins are formed by the sacrotuberous ligaments. Okay, so this aperture we are going to see separately when we are dealing with the diameters. So again we are going to discuss the same borders on the diameters of the outlet again. Now we are going to see, these are all about this borders of greater pelvis and the lesser pelvis, and which structure separates the greater pelvis and the lesser pelvis, and the boundaries of that pelvic brim, And also we have seen that inferior pelvic aperture or pelvic outlet. Now we are going to see the diameters of this bony pelvis. Here, if you are going to consider the bony pelvis, means the bony pelvis is nothing but here the true pelvis. We are going to consider the measurements of the true pelvis, that is called as osteometry of the pelvis. This osteometry of the pelvis includes the measurements for pelvic inlet, pelvic outlet, and also pelvic cavity. Now the first one we are going to see is the pelvic inlet. Yes, so this is the pelvic inlet. I have already mentioned the plane of pelvic inlet when we are dealing in the introduction of this abdomen. This abdomen is divided into greater part and the lesser part. So that greater part is divided from the lesser part by the plane of this pelvic inlet. This pelvic inlet is a line drawn from the sacral promontory to the pubic symphysis, which makes 55 degrees with the horizontal plane. Okay, so that plane of pelvic inlet, okay, that is the plane of pelvic inlet. Now we are going to see the measurements of this plane of pelvic inlet in all the sides. So this is a view of pelvis superiorly. So this is the superior view. We can call it, this one is also called as antero-posterior view. That means we are also seeing some anterior as well as the posterior part of the pelvis to show the diameters of the pelvic inlet in millimeters. Okay, so this is the AP view. So we are seeing this anterior and the posterior view structures. So this is the pubic symphysis. Okay, and now we are going to see the diameters. It is having three kinds of diameters. One is the AP diameter. So this one is called as AP diameter. This is the AP diameter. And next one is the transverse diameter. This is the transverse diameter. And another one is the oblique diameter. This one is the oblique diameter. So now we are going to see from where to where this anterior AP diameter is measured, and transverse diameter is measured, and oblique diameter is measured. Now this AP diameter is measured from the upper border of the pubic symphysis, from the upper border of the pubic symphysis to the sacral promontory, It is about 110 millimeters. This is about 110 millimeters. And coming to the transverse diameter, the transverse diameter is the widest part of the pelvis. So this transverse diameter is the widest part of the pelvic brim. We can call it as pelvic brim. And it is about 130 millimeters. So it is about 130 millimeters. This is called as the maximum transverse diameter of the pelvic inlet. That means throughout the pelvis, which area forms the maximum part of the transverse diameter, that forms the transverse diameter of the pelvic inlet. Okay, now coming to the oblique diameter. So this oblique diameter is measured from one iliopubic eminence. So iliopubic eminence, so which is present across in one hip bone and to the other opposite one. So it is measured from one iliopubic eminence. So iliopubic eminence, here you can get this iliopubic eminence on both the sides. So ilium and pubis are going to unite at one part. You'll have this iliopubic eminence. So from there it is going to be measured to the opposite sacroiliac joint. So this one is the opposite sacroiliac joint. So this is it is measured from iliopubic eminence to the opposite sacroiliac joint, like the same way. So this one, okay. So this is the oblique diameter, which is measured from one iliopubic eminence to the opposite sacroiliac joint. So it is about 125 millimeters. So these are the diameter of the pelvic inlet. So I have already mentioned the boundaries of this pelvic inlet. Posteriorly it is formed by the sacral promontory and a ridge which is separating the anterior and superior surface of the sacrum, and then the arcuate line. This one is arcuate line, and then pecten pubis and pubic crest forms the pelvic brim on both the sides. Okay. Next one we are going to see is the pelvic outlet. So this is the pelvic outlet. So this part is seen from below pelvis. So if you rotate this pelvis towards back side, you can find out from anatomical position to backwards. So then you can see this pelvis here, outlet of the pelvis. So I have mentioned already the borders, isn't it? It is highly irregular. The pelvic outlet is highly irregular. So it is formed anteriorly by the pubic arch. This is the pubic arch. Okay. And laterally by the ischial tuberosities. So these are the ischial tuberosities. And the lesser sciatic notch and the ischial spine. So all will come below this thing. Okay. And posteriorly by the lateral margins of the sacrum and the coccyx. Okay. So on lateral sides there is no bony components, but laterally it is surrounded by the sacrotuberous ligaments. So these are the boundaries of the pelvic outlet here. Next, now we are going to see the measurements of this pelvic outlet. Okay, so we can see the plane of pelvic outlet here. It is an imaginary line drawn from the tip of the coccyx to the pubic symphysis below, and which makes an angle of 15 degrees with the horizontal plane, that is called as plane of pelvic outlet. Now in this we can see the diameters. So one is again AP diameter, transverse diameter, and the oblique diameter. So the first one is the AP diameter. In this AP diameter, it is measured from the apex of the coccyx. So here you can see this. This is the apex of the coccyx to the lower border of the pubic symphysis. This is the lower border of the pubic symphysis. This forms the antero-posterior diameter, and it is about 125 millimeters. So the AP diameter is greater in the outlet when compared to the inlet. Next, coming to the transverse diameter, the transverse diameter is measured between the two ischial tuberosities. So this is the ischial tuberosities. So it is measured in between the two ischial tuberosities. It is about 110 millimeters. So the transverse diameter in inlet is greater and outlet is lesser. And coming to the oblique diameter, it is measured from the midpoint of the sacrotuberous ligament of one side to the junction of the ischial and pubic rami on the other side. So that means here, so at the center of the sacrotuberous ligament, that is the midpoint of the sacrotuberous ligament, and towards the what you call it as ischial and pubic rami junction on the other side. It is about 118 millimeters. Okay, so these are all the diameters of the pelvic outlet. So, and also some measurements used in obstetric practice. So in that, so you have to see again to the main pelvis again. So in this, some 3 diameters they are going to mention in this. So one is the diagonal conjugate. So diagonal conjugate is one measurement. It is the distance between the sacral promontory and the lower border of the pubic symphysis. So it is the distance between sacral promontory and the lower border of the pubic symphysis. So here, and then the lower border of the pubic symphysis. So this is called as diagonal conjugate. And another diameter is the intercristal diameter, is the greatest width between the iliac crest. So you'll see this iliac crest. So the greatest width between these two iliac crest is called as the intercristal diameter. And also interspinous diameter, it is the distance between the anterior superior iliac spine. So this is the anterior superior iliac spines. These are the distances. So if you can see the distances, are in between these two iliac crest, it is called the measurement is 250 millimeters, whereas this interspinous is 275 millimeters. That means interspinous diameter is more than the intercristal diameter. So the difference between this intercristal diameter and the interspinous diameter is regarded as an indication of the width of the pelvic cavity. So these two diameters indicate the width of the pelvic cavity. Okay, so these are all some of the important measurements used in obstetric practice. Okay, now we are going to see there are different types of female pelvis we can see. So there are 4 types of female pelvis are present. One is the gynecoid type, and next one is the android type, and platypelloid and anthropoid types. So now first one is the gynecoid type. So gynecoid type is the normal female pelvis. The average diameters of this type of gynecoid is same as that of the diameters what we have mentioned earlier in the case of inlet as well as in the outlet. Here in this, the inlet is almost round. So you can see this round. So the inlet is round or slightly ovoid with transverse diameter placed well forward from the sacrum. So you can see this transverse diameter which is almost far away from the sacrum. Okay, yes, and the side walls are more vertical than in the android pelvis. So next one we can see the side walls. So this side walls is almost vertical when compared to the android pelvis. So when we go to this android pelvis, you can understand this vertical type. So this android type, so this is also one kind of female pelvis which resembles the male pelvis, that is 32.5% of the females will have such kind of male pelvis. Here if you can see the inlet is triangular in shape. So here the inlet is triangular in shape. Okay, and with the greatest transverse diameter placed much nearer to the promontory than the gynecoid pelvis. So I have mentioned that the transverse diameter is the greatest wider part. So if you can see, this is the most widest part of this pelvis forms the transverse diameter, which is nearer to the sacral promontory. So if you can see this one, which is far away from the sacral promontory. In the gynecoid pelvis, the transverse diameter is placed well forward from the promontory. Okay, this is the difference. Okay, and the subpubic angle and greater sciatic notches are narrower so that the cavity is funnel shaped and outlet is reduced in all diameters. So because of this greater sciatic notches are narrower, so this one is greater sciatic notch is narrower, and the subpubic angle, so the angle which is present below this pubis is also narrow, so that the cavity appears to be a funnel shape. So it appears funnel shape means the outlet, the diameters of the outlet is reduced. So the thing, what are all the diameters we have seen earlier, all those measurements are going to reduce in android type. Okay, now coming to the platypelloid pelvis. So this platypelloid pelvis is normally resembles to the pelvis of anthropoid apes. So this platypelloid is also called as ape pelvis. So here in this, the pelvis is transversely wide, flattened shape, and also wide anteriorly, and greater sciatic notches are of male type. It has short sacrum that curves inwards, reducing the diameter of the lower pelvis. So this is one kind, that is platypelloid type. Platypelloid type is not seen in apes. So anthropoid is seen in apes. So this platypelloid is seen only in 2.6% of female population. Okay, so this one is transversely wide, flattened shape, and also it is wide anteriorly, greater sciatic notches of male type. It has short sacrum that curves inwards and reducing the diameter of the lower pelvis. Coming to the anthropoid, so it is commonly resembles as ape pelvis. It is seen 23.5% of female population, and it is characterized by oval shape. It is having greater AP diameter. It has straight walls, that means this ischial and greater sciatic notches, so which are almostly in the straight way, and a small sacrosciatic notches. Sacrosciatic notches are small. The sciatic spines are widely apart. Sacrum is usually straight. The sacrum is placed straight. So because of all these arrangement of these bones resulting in deep, non-deep obstructed pelvis. So these are all the types of the female pelvis. Out of these various types of female pelvis, only this gynecoid type of pelvis permits a normal delivery of the child. The other three represents different types of contracted pelvis, and in these three pelvis it is difficult to have a normal delivery of a baby. Okay, these are all the types of female pelvis. And then now we are going to see the differences between the male pelvis and the female pelvis. So in the male pelvis and the female pelvis, so these are all the anterior view of male and female pelvis here on both the sides. So the false pelvis is deep in male, that is the upper part, so the greater part. The false pelvis is deep in males and shallow in female. The pelvic inlet is heart-shaped in male due to jutting forwards of this sacral promontory. In female, it is transversely oval. It is transversely oval. In male, it is heart-shaped. Okay. And the pelvic cavity is smaller in male, and pelvic cavity is shallower in female. Okay, the pelvic cavity is smaller and also deeper in male. In the case of female, it is roomier and shallower. That is, distance between inlet and outlet is shorter. Okay, so the pelvic outlet is smaller with ischial tuberosities turned inside in males. So the pelvic outlet is smaller with ischial tuberosities turned inside in male. In female, the pelvic outlet is bigger with everted ischial spines. Okay, and the sacrum is longer and narrower in male, while in female it is shorter and wider. It is shorter and wider in female. The subpubic angle is narrower, that is 50 to 60 degrees in male. The angle is wider in female, that is up to 80 to 85 degrees. This is the most important difference seen in male and females. The greater sciatic notch is wider in females and lesser in males. When you compare with this female and males, the greater sciatic notch is wider in females than in males. The acetabulum is large in male and its diameter is approximately equal to the distance from its anterior margin to the pubic symphysis. Okay. The chylotic line, which extends from the iliopubic eminence to the iliac crest. So, iliopubic eminence to the iliac crest. Okay. In females, the pelvic part of the chylotic line is longer than the sacral part. So this line, chylotic line, is longer than the sacral part in the females. Okay, so chylotic line, if you can see in detail, means a line extending from the iliopubic eminence to the nearest point on the anterior margin of the auricular surface and then to the iliac crest. Okay, iliac crest means the sacral part. Okay, and the anterior margin of the auricular surface means the pelvic part. Okay, and then so this becomes the pelvic auricular surface. This becomes the pelvic part, and then it reaches to the iliac crest. This iliac crest part is called as sacral part. Okay, so this pelvic part of the chylotic line, so that means the pelvic part of the chylotic line is relatively more in female than in males. Okay, so that is the thing. Next, the pre-auricular sulcus is more marked in females. Pre-auricular sulcus is more marked in females. So these are all the differences between the male and female pelvis. So these are all about the bony pelvis. In the next session, we are going to see the anterior abdominal wall. Thank you.